Losing your hairline is devastating, and some of us fortunate enough who aren't there yet might get there. And when we do, we need a plan in place, because while you're losing your hairline, you don't want to lose yourself, because you only get one shot, one opportunity. What am I doing? Right now I'm standing with Dr. Carlos Portengia.
Yeah.
I practiced that 10 times before I said it and I got it right. Welcome, doctor, to Oman.
Thank you very much. It's a
And
pleasure being here.
we can see a lot of equipment in the background. I don't know what they do and how you operate them, but we have you. And you're gonna take us around and tell us all about it?
Sure.
Yeah?
Sure. One of the things that makes Insparya different from the rest of the groups, and that's one of the reasons we have Cristiano Ronaldo with us, is that we are very well differentiated in this area. And this is because we have biomedical and technological research inside our doors. So we perform both these researches. From the biomedical side, we want to find new treatments for the hair, for the alopecia, which is a disease that affects the hair and makes it fall. We want to find new treatments, and we are in the merge to launch a new pharmacy, a new drug to treat the hair, which will be amazing.
Actually, as we're on the subject,
Yes.
I remember you telling me you can't tell me the name of this new drug.
No, I can't.
But you can definitely tell me the difference between the old drug and the new drug, how they differentiate in terms of, impacting you.
Yeah, I'll try to tell you something without revealing anything.
I was trying to be smart, but I failed.
No, but one of the amazing things in this find of Insparya is that with this drug we know where it acts, what it does, and why it has an amazing effect in hair regrowth. And this is absolutely new, because when you talk about other drugs like minoxidil, you don't know how it works. When you talk about finasteride, there's a drug for the prostate for men, and it also has some effect in the hair, but it has this effect in the hair, but it has bad effects in the sexual life of the man. So we always have to think about this. This new drug that we are developing is a drug that won't affect any other parts of the body, and will have this amazing result in the hair of our patients.
It's like a laser guided missile. It goes exactly to the point where you want it to go.
It's a good image, yeah. But we're not only biomedical, and of course we want to know more. We want to multiply the follicular units in lab. We want to know more about the follicular unit, which is the microorgan that produces the hair. Right. But we also have the technological branch of our research. And in this area, we want to develop a robot that in the near future, will do the whole procedure, harvesting the hair, classifying the follicular units, and implanting these follicular units where they should be implanted.
And did I hear you right when you were giving your speech? You said that you'll be able to perform surgery sitting in another country,
Yes.
and a patient in Oman could get your expertise while you're out of the country.
I don't know if you know, but Insparya is the only brand in this area, in the hair transplant area, that has the quality certification, the ISO 9001, in all the clinics. Of course, we don't have yet in Oman, because we have to work for at least 1 year to have that certificate. This means that we follow some rules for our procedures, and those rules are followed in all the clinics. So when you go to a clinic in Porto, in Lisbon, in Madrid, in Milan, or in Oman, you know that the procedure will be done the same way, with the same results and with the same guarantees. But even like that, we always have the differences between the patients, but also the differences between the teams. They are all amazing, but there are so small differences. What I want as a chief clinical officer of the group is to guarantee that the hair transplant is done exactly the same way every time. And this can only be guaranteed with the robot. That's why we are developing it. But we don't have the robot finished, but we have one thing finished. That is what will be in the end of the robot. And this is this amazing device.
This one, all right.
The Botter Ultra Plus. So our future robot will have all these devices in its end.
Okay.
So it will perform with this device, which is the harvesting device. It will harvest, aspirate the follicular unit. It's missing a tube here because I'm not doing the hair transplant. Then the follicular unit goes through this tube to this bottle here, which has the preservation solution, and the follicular units come here, and the patient has all follicular units harvested without the doctor touching the follicular unit. That is amazing. because this increases the survival rate to over 99%, which is unparalleled. Okay.
I think it does sound amazing. Actually, all the information you've given me right now, I have only one question before I end this interview. When do you think I will need it?
Oh, I don't know. I know I was almost like you. Yeah, at my 29th, I'm almost 50. When I was 29, I lost all my hair in 2.5 years. So I got completely bald, and the hair you're seeing here is all transplanted by my teams.
So basically, in the intro, like I explained, that if you're fortunate enough to have a lot of hair on your head, you might get there at some point, and for that point of time, you need a plan in place, and that's where Insparya comes into play. So you know who to contact. Oman International Hospital, they've recently launched this Insparya. It's called Hair Transplant Team Group.
Hair Transplant Group. Yeah.
Group. They have a set of expertise here who can help you out in whatever your need is. And thank you so much, doctor, for your
It was a
time.
pleasure.
And hope to see you soon, inshallah, back in Oman.
No, I hope to come back soon because I love this country.
We all love this country. Thank you so
Yeah,
much.
thank you
Have a
so
great
much.
evening.
Thank you.
We feel really privileged to be here tonight in the inauguration of the first clinical branch within the Middle East. We already have 13 clinics in Europe, in 3 countries. We believe, we trust that due to our technology, our practice, medical practice, we have the best and the most premium hair transplant in Europe. And that's why we are also coming here into Oman in partnership with the Oman International Hospital, since we also share the same core values in order to give the best value for our patients. We are really happy with that.